So our next candidate is Assembly Member Dr. Richard Pan. He's a physician and an educator who has dedicated his life to solving problems and helping everyone in the community he serves. As a pediatrician, he cares primarily for poor and uninsured children. As a teacher, he taught future physicians the importance of community and health. Dr. Pan is a father, husband, and son and understands the challenges of raising a family in our community. He and his wife started a small business to meet payroll, balance a budget, and work to do more with less. His parents immigrated to America to build a better life for themselves and their children. Dr. Pan believes in creating opportunities for all Californians to succeed and to also give back. Help me welcome Dr. Richard Pan.
Thank you so very much. I'm Dr. Richard Pan. I'm a pediatrician. I actually came to Sacramento after I finished my training to practice at UC Davis and help run the residency training program. I actually established a program to get our doctors out into the community because I knew, because I told them that your patients don't live in the hospital or the clinic, they live in the community. So you need to form partnerships to better understand what's going on in the community to help them improve their health. In fact, that's the same philosophy I take to elected office as well. We can't stay holed up in the Capitol, and we need to be sure we're out in the community. In fact, I'm proud that at my district office in the heart of South Sacramento on 25th, 4th, and Florin, so we right next to actually one of the Mexican grocery stores. So we're and with a lot of nonprofits, so we can be sure we're there where the people are. You know, I didn't grow up planning to run for elected office. Having spent 20 years in elected office, I spent more than 20 years helping people in the community. And in fact, here in Sacramento, after I came to Sacramento, proud to have worked to start a nonprofit, get 65,000, worked to bring people together to try to address the safety net. The county, when the recession hit, was cutting back clinics, closing county clinics left and right, cutting mental health. I saw that what was happening to my patients, many of them who were having challenges with behavior or learning disabilities at schools. And they were getting the services cut by the county. And so I brought people together to form a coalition so we could go and try to strengthen the safety net. In fact, established a federally qualified health center, now well space, where I actually still continue to practice. I still continue to practice medicine even today. I ended up running for office in 2010 because I saw people were tired of the gridlock that was happening at the Capitol, where elected officials, politicians couldn't come together to get our budget passed to solve problems in our community. And so people urged me to run, and I finally said, well, I'm not willing to throw my hat in the ring, how can I complain? In fact, when I ran, I wasn't supposed to win because I was this pediatrician who never held elected office, but people wanted someone who wanted to work to solve problems. They were tired of the ideologies, the bickering, and they wanted someone to solve problems, and that's how I won the election. And what I do since I got elected, in my brief time as elected official in the last 4 years, I've worked to try to solve problems. Worked with the fire departments. We're going to be bringing in over $127 million of federal matching funds for local fire departments. That's actually helping not just fire departments, but city budgets as well. We work to be sure we protect children and seniors from expired baby formula and expired medications. I worked with people to be sure that to add severe combined immunity deficiency, sometimes known as bubble weight disease, or the movie John Travolta, to the newborn screen. Something that not only is saving 20 lives a year, actually disproportionately affects the Latino community, but is actually saving the state $20 million on top of that, because the cost of actually treating these children before they died was more expensive than actually diagnosing them up front and getting them actually curing them so that they could actually lead full lives. As chair of the Health Committee, I worked hard to be sure we effectively implemented the Affordable Care Act. I authored legislation to be sure people would not be denied for health care coverage for pre-existing conditions, that they would not have their insurance coverage run out on them. I worked with public safety, partnering with the police to be sure that we have a database that can help combat crime, property crime, mental theft that is plaguing our cities. We've worked with a variety of different groups to solve problems. I'm proud of what we've been able to do, but there's still much more that needs to be done. We still have work on our healthcare system. The Affordable Care Act is not just about enrolling people, it's being sure people get health care. So I'm working to try to to improve our Medi-Cal system to be sure that people can actually get health care. we've been going out in the community, talking to people, working with small businesses to figure out where are the regulatory barriers that are keeping them from succeeding. And what can I do as a small business owner? I'm a small business owner to face as many of the issues that they face to be sure we can try to address those. So I'm proud. I'm going to continue to work hard. I want to continue this work in the state senate, and I hope that I can earn your vote to do so. Thank you so much.
Dr. Penn, in today's Sacramento Bee, there was an article about SCA 5. It's a very difficult question for everyone involved, but there is an absolute need to have Afro-Americans and Latinos increase within the UC system. What is your proposal for doing that?
So I've been a lifelong proponent for affirmative action. In fact, before I ever got to the legislature, I was on a committee for the American Academy of Pediatrics, my own professional organization, and I co-authored a policy saying that the AAP, pediatricians nationally, will support affirmative action. I also know that race is a factor in people's education. So how can we just simply turn it off at the admissions point? I myself, when I grew up, I actually had an unfortunate experience where I was in school and there was an opportunity to be in an advanced math class. We had to take a screening test. I didn't make it into that class. Later I found out not because I didn't score high enough on the test, because, as they told my parents, they didn't have enough books. It was interesting, though, that the people who made it in that class were all of one race, and those of us who didn't were of a different. So, I've had personal experience with that as well, knowing that sometimes there is discrimination and opportunities. The ultimate goal is really being sure people have equal opportunity. Equal opportunity no matter what your race is, no matter what your socioeconomic class is. That's what America is really about, equal opportunity. And we need to recognize, if we're going to truly achieve equal opportunity, we need to recognize the barriers that we put in place for people to have that equal starting place when they hit to apply for whether it's college or graduate school. And we also see this even in the workplace. And when you look at who are our CEOs, the gender and racial discrimination, who are the managers in businesses and so forth. So we need to have an honest conversation about what it takes to get equal opportunity.
I'm sorry.